This is Katrin with Disability Rights New York. Welcome to our podcast, Empire State of Rights Closed Captioned. We are here to bring you information on the most relevant topics regarding disability rights and advocacy. As New York State continues to address the coronavirus pandemic, Disability Rights New York will be recording podcasts specifically targeted at bringing you up-to-date information and resources, and we will do our best to get you information as it changes. If there is a topic that you would like us to address, please comment below or email us at podcast@drny.org. Today, we welcome Mark Fliedner, DRNY PAIMI PAIR Director, and today we'll be talking about returning to the workplace after COVID-19 shutdown. Mark, thank you for joining us today.
Very glad to be here as always.
So today we're talking about returning to your workplace and how we can assist people in self-advocating for specific reasonable accommodations they require in order to return to work or to work from home during the COVID-19 pandemic. Self-advocacy is particularly important to those who are especially vulnerable to COVID-19 and those who are caring for someone who is vulnerable to COVID-19 as well. Mark, when we say someone who is vulnerable, who are we talking about?
While some folks may know this, it's always good to remind ourselves that those who have medical experts have told us particularly vulnerable are certainly women who are pregnant, folks who are 65 or older, which happily is still a significant part of the workforce, folks who have certain medical conditions that include things like diabetes, lung disease, anything that impacts on the ability to have a strong lung capacity, and those who have compromised immune systems. So it actually ends up being a significant portion of people. And then I think you really do, in some cases, have to add to that those who live in close proximity with family members who fall into those categories because they've got to protect themselves for everybody's sake.
And for our audience members who maybe aren't familiar with what a reasonable accommodation is, will you explain what that means as well?
Sure. A reasonable accommodation is something that is really, it is somebody's required to provide consistent with the Americans with Disabilities Act, who's employing somebody who has a disability. And while we're talking broadly about people over 65 years of age, I'm finding that the calls that we're getting from people seeking advice are from folks who have been diagnosed with some kind of a disability. Really interesting issue just arose on the telephone right before we started this podcast. A woman called me who had two reasons why she needed to be concerned. One was because she had been diagnosed with diabetes, which we just mentioned, and another was because she had another medical condition that required her to take a medicine in order to be safe and sound daily that significantly compromised her immune system. So in that sense, she had two reasons why she would be seeking accommodations. And so what that means for an employer, now that we're entering this let's get back to work phase of the COVID-19 pandemic process, is that it means that employers need to be accommodating not only those who have disabilities overall, but those whose disabilities make them particularly vulnerable to the impacts of COVID-19.
And my guess is our audience members are going to wonder, what is that conversation going to look like? What are employers going to be allowed to ask? What do you need to provide them with? Like, how is this process going to work? And will it be a short process, or is this something that's going to take some time?
That's a great question. So first of all, it begins with the employee making sure that the employer knows that they're seeking a reasonable accommodation. So that's kind of an affirmative responsibility. So our clients need to start the conversations with the employer. And then the kinds of things that we're going to want to be looking at in terms of, and really what the client needs to do is come with a proposal for a reasonable accommodation. And an important step before that should be a consultation with your doctor, right, or your service provider about what are appropriate accommodations to keep you safe from COVID-19 that don't apply to everybody else. And the kinds of things that we ask folks to look at in preparation for that first conversation with the employer are, can you identify things that will limit the exposure that you would generally have in your workplace through physical proximity with others, things like that? Can you identify ways that you will be able to work from home and still be able to provide your essential job functions? And another category is, Are you somebody who has access to a leave policy established by your employer either prior to or during the pandemic that anticipates the need for somebody to be able to have access to that leave? So those are some preliminary steps. And we ask people to be really creative and really thoughtful in preparing their plan for the employee.
Something that I think is important for us to point out is that no two accommodations will necessarily be the same, right? I mean, one person's accommodation may not fit for another. These are going to be specific and based on you as an individual. How does that work as far as looking at someone else's accommodation and saying, oh, gee, that might be something I need, or I don't need that, so I don't get to have an accommodation?
Well, interestingly enough, in this situation where we're talking about ways that you need to keep yourself safe from COVID-19 because you're particularly vulnerable, there may be more commonality between the different solutions that people come up with than there is if you're just trying to accommodate all of the extraordinary, array of disabilities that folks can have. So what we're talking about is things that allow you to refrain from extended, consistent contact with the public in environments where social distancing is not something that's easy to accomplish. If you've got somebody who is interacting with the public, like a safety patrol officer or a paramedic or something like that, the ability to be able to accommodate your need for protection under these circumstances is challenging. And one of the things I always tell people to look at is, let's look at your job and think about how it could be done in another setting. Like, for example, there was one gentleman that called and said, well, I am an anesthesiologist. So obviously one part of my job has me actually administering anesthesia in a hospital setting. But I also have been doing a management function that I can completely do from home. And so I suggested to him that he pitch to his employer that he would like to be able to focus on that essential job function of the management piece for a period of time while we continue to feel more and more in control of the COVID-19 threat. So it's a matter of really looking at your situation, looking at your kind of employment, looking at what your employer's capabilities are, and then making a pitch that is, in fact, reasonable and still allows you to do the essential job function. I should say that if you simply cannot provide your essential job function because of the need to protect yourself from COVID-19, then those are the kinds of places where we want to cause people to start to look at FMLA, Family Medical Leave Act, and things like that they need to request because they need to protect themselves uniquely.
And so as we talk about planning for asking for accommodations, really we're talking about communication as being key in best practices here. So the communication must start with the individual and go from there. I mean, does that make sense? Is that something that we could say for our audience? Start with you and continue on with your doctor and then to your employer?
I think that's absolutely true. I think that the first thing is for you to think through your options. But I definitely think that before you get your employer, you need to have contact with that healthcare provider, because ideally you and your healthcare provider will agree together what situations put you at risk, particular risk, and what situations don't. And then the healthcare provider will prepare a document for you, generally a letter that simply states, I've met with my client. This is the client's disabilities that make them uniquely vulnerable to COVID-19, or this is the medication or the service they're being provided that makes them uniquely vulnerable. And then state that I want to educate you, employer, about what my patient's needs are. And then I want to tell you that I'm respectfully saying that my client needs this accommodation in order to be safe and sound. And ideally, you have that letter in hand and your proposal before you step into that meeting with the employer.
Certainly, there is so much going on right now for everyone who's experiencing any type of change from COVID-19, whether it has to do with work or school or anything like that. And if our audience members still have questions and they're looking for answers, how can DRNY help someone who's looking for information about reasonable accommodations specific to COVID-19?
Sure. Well, it's going to be just like the phone conversation that I had when we before I came on the air with you, and that was that they can contact our intake and let them know that they have questions about what they should do to self-advocate, and then we get back to them. A staff attorney gets back to them, in the case of reasonable accommodations, and walks them through it, much as I just did with a client. And we also make it clear to them that while self-advocacy is usually the way to address reasonable accommodations, if they reach an impasse with the employer and they are asserting that this is something that's reasonable, consistent with the Americans with Disabilities Act, but the employer says we disagree, then they may need more formal legal advocacy and they should call us back so that we can work to resolve that impasse and get them safely back to work.
And Mark, I'm sure there's going to be many new questions as we start to return to any sense of typical life before COVID-19. Is there anything else that you'd like to share with our audience before we wrap up here today?
You know what I'd like to share with the audience is something that I think that we're constantly reminding ourselves. It's a little broad in its scope, but I just want to remind people that among the accommodations that we're making sure our employers honor are PPE, masks, for example. I just want to remind folks that we do that, and it goes back to our story about those who reside with people that are particularly vulnerable. We do that not as much or not only for our own sake. We do it for the sake of others. And that I just hope that we continue to do that in the positive spirit that I've seen most people participate in, so that we can keep this curve going the way that it's supposed to.
That's right, Mark. Thank you so much for your time today.
My pleasure.
Empire State of Rights Closed Captioned has been brought to you by Disability Rights New York, your source for disability rights and advocacy. If you enjoyed our program, make sure to subscribe, like, and share this post. If there is a subject you would like us to discuss, please email podcast@drny.org or comment below. Tune in next Wednesday, where we'll bring you more information on disability rights in the state of New York. The closed captioned and ASL version of this podcast is available on our YouTube channel. To listen to more Empire State of Rights closed captioned, follow us on Apple Podcasts and Spotify.